My name is Nate Epp, and I am account executive here at HORAN. Along with me on this call is Mike Hermes. Mike and I are going to go over Medicare and Social Security today. I'll start off with Medicare. We're going to spend the first probably 35, 40 minutes on Medicare, and then I'll hand it over to Mike, and he'll finish off with the remaining 35, 40 minutes on Social Security. And we'll save questions at the end, but you're welcome to put any questions you have in the chat box, and then Mike and I will go through those questions and answer them. And we'll hang on at the end of the presentation for any other follow-up questions at the end. We are recording, so when we're done here, we'll send a link where you can view this presentation at a later date along with the slides. And we'll go ahead and get started. All right. So we'll start off with Medicare. Medicare started in 1965, and Medicare is designed for three groups of individuals. First group of individuals are those who qualify for Medicare based on their age. So you are first eligible to start Medicare the first of your birth month. Okay. So wherever your birthday falls in the month, you can start Medicare the first of that month. All right. I always have at least one person in the crowd whose birthday happens to fall on the first of the month. If that's you, you can actually start Medicare a month earlier if you want. So if your birthday is September 1st, you can start Medicare August 1st if you wanted to. Okay. But for everyone else, it's always the first of your birth month. Second group of individuals are those who qualify for Medicare because they are on Social Security disability. And this can be of any age. So we have some clients in their 40s and 50s on Medicare already because they've been on Social Security disability for 24 months. Okay, once you're on disability for basically 2 years, you're automatically enrolled in Medicare at that point on the 25th month. All right, that's the second group of individuals. Third group of individuals, we maybe see this a couple times a year, are those who are diagnosed with end-stage renal disease, that's permanent kidney failure, or ALS, Lou Gehrig's disease. Diagnosis of either of those, you also qualify for Medicare regardless of your age. Okay, those are your three groups that qualify for Medicare. And Medicare has 4 parts, A, B, C, and D. It's going to kind of feel like we're going through half the alphabet today, but I just want you to know there's basically 2 main components to this whole Medicare puzzle, okay? There is the government component of Medicare and the insurance component to Medicare. Parts A and B, so on the screen you see Part A and Part B, that's hospital and medical. That's the government portion of Medicare. Okay, those are the 2 parts of Medicare the government provides. Everything else in Medicare, so Part C, Part D, there's also a product called Medicare Supplement. Those are insurance plans sold by insurance companies. Okay, so as we get through this presentation, my goal is, so you can understand how the government component and the insurance component work together and what your options look like. All right, so we'll jump in here to, actually we won't jump into those 4 parts. We're going to start off with just a couple common myths with Medicare, and then we'll jump into those 4 parts. I hear a lot of misconceptions every single day. So that's part of my job here at HORAN, is I'm what they call a licensed agent. We're an independent broker. So when folks come to us and they need help with Medicare, we contract with about 10 different insurance companies, and we help people research all these companies, look at what their needs are, and try to help you figure out what the right plan is. So we do this all day, every day, and I hear a lot of misconceptions with Medicare. Number one, this is one I hear every day, is a lot of folks believe that when you hit age 65, you are required to sign up for Medicare. That is true for some people, but it's not true for everyone. Okay, so this is a very important rule. If there's only a couple things that you take away from this presentation, make this one of them. All right, so Medicare says that as long as you have health insurance coverage through an employer, and this counts if you're a spouse on your spouse's employer. Okay, as long as you have that group health coverage, and as long as that company, that employer, has 20 or more employees, then you do not have to sign up for Medicare at 65. Okay, you are allowed to delay signing up for Medicare and stay on the employer plan until you're ready to retire or come off that employer plan. Okay, and there's no penalty as long as you maintain that coverage. You can delay it basically as long as you have the coverage. So I'm talking to people now that are retiring at age 68, 69, 70, and they haven't been on Medicare at all because they've been on their employer plan, and they're going to be fine. There is no penalty. So keep that in mind. Now, if you have coverage through an employer and they are under 20 employees, then you do have to sign up for Medicare. Otherwise, there is a penalty. But for most of you on the call, if you have coverage through an employer, more than 20 employees, option number one is don't do anything. You can simply just stay on your company plan and keep working. Okay. Now, turning 65, that does count as a qualifying event. That allows you to come off of your employer plan if you want to. Okay. So whether that is a good idea for you or not, it depends on several things. So it depends on how much are you paying for your current coverage through work. What is the coverage like? You know, is it work for you? Does it not work for you? And third is, how does that compare to Medicare? So I help people do this all the time when they're reaching 65. They want to know, hey, what's the better deal? Is it my employer coverage or is it Medicare? And same thing for a spouse. So sometimes I do this, and you know, when we compare what you're paying to your employer, it's not so much for the employee, but it's a lot for a spouse. I see that sometimes. So sometimes it makes sense for the spouse to go on to Medicare and for the employee to stay on the health plan. So those are the kind of things that we can help you work through and help you figure out, should you sign up or should you not sign up when you hit age 65. Okay. All right. Number two, health savings account. So for those on the call right now, if you are on a health savings account plan through your employer, there's a lot of rules that you need to be aware of. Okay. But there is a myth here that I hear this a lot as well, is that you can't put money into your HSA once you hit age 65. Okay, it has nothing to do with how old you are. That it's whether or not you are enrolled in Medicare. So remember, the rule is, as long as you have coverage through your employer, you don't have to sign up for Medicare. So if you don't sign up for Medicare, you stay on your employer plan, you can keep putting money into your HSA. But if you do sign up for Medicare, then as soon as you enroll into any part of Medicare, you can no longer put money into that HSA, and your employer can't put contributions in there either. Okay, so I hear that advice a lot. A lot of people tell me, well, someone told me that I need to sign up just for Part A of Medicare. And a lot of people sign up thinking that's what they have to do. And you don't have to sign up for Part A when you hit 65. It's optional. Okay, so whether signing up for Part A or not is a good idea for you, that depends on what type of health plan you have. So if you're on an HSA, our advice is, if putting money into that account is important to you, then don't sign up for Part A when you hit 65. But if you're not on an HSA, let's say you're on just a traditional, just a regular, traditional type of health plan through your employer, go ahead and sign up for Part A. There is no downside to doing that. Okay, so whether you should sign up for Part A at 65 or not just depends on, are you on an HSA plan or not. Okay. Number three. So I hear this sometimes as well. A lot of folks believe that as soon as you hit age 65, everyone just automatically gets enrolled into Medicare, and that's not necessarily the case. Okay, that is true for some individuals. So if you start collecting Social Security early, so if you start collecting Social Security at 62, 63, 64, when you hit age 65, you are automatically enrolled in Medicare. But if you're not collecting Social Security, when you hit age 65, nothing is going to happen. Okay, you are not automatically enrolled. The only way you would be enrolled into Medicare is if you actually filled out the application to get on Medicare. Okay, so it is automatic for some, but not for everybody. So those are the three most common misconceptions. And again, any other things that you need to clarify, throw them in the chat box, and we'll address those here at the end. All right, let's jump into those 4 parts. So Part A of Medicare, so this is one of the 2 parts that you get through the government. There is no cost to Part A as long as you or your spouse have worked at least 10 years of your life paying Medicare taxes. At that stage in life, that accounts for like 99% of the population doesn't have to pay for Part A. But there is a requirement there to have paid Medicare taxes for at least 10 years, either you or your spouse. So what does Part A cover? So under Part A, that is all of your inpatient medical expenses. That includes inpatient in the hospital, skilled nursing facility, hospice. Those expenses roll up under Part A of Medicare. Now, another misconception that I hear all the time, a lot of people believe that Medicare just covers all of your medical expenses, and that is not true. Okay, so Medicare only covers a portion of your expenses, and it leaves you responsible for a portion. So, for example, under this bullet point here that says how these services are covered, I'm going to walk you through just a quick example of if you had Medicare Part A just by itself and nothing else, this is how it would work. Okay, so if you get admitted into the hospital, you have a deductible. It is $1,484. Nice, easy, round number. So that's your deductible. That's your responsibility, $1,484. Medicare pays the rest of that hospital stay. Not bad when you think of, a hospital bill and a deductible, not bad. However, this deductible is not the kind of deductible that you're used to. It is not a one-time calendar year deductible. It resets every 60 days. So if you go into the hospital, you owe the $1,484. If you get out of the hospital and 60 days go by and you happen to go in the hospital again, you'll owe another $1,484. Okay, so if you have a rough year, numerous trips in the hospital, there's a chance that you might owe that deductible multiple times. Okay, and then you can see here on the screen that, if you hit day 61, you'll not only owe the $1,484 deductible from the first set of 60 days, but now it's a per day charge for each day that you're in there. And then that charge doubles if you ever hit 91 days in the hospital. So, while Medicare does provide this base coverage, we really try to stress in this presentation that you want Medicare, but you also want to pair it with some type of insurance product. That's the purpose of having an insurance plan, is it'll pick up either all of these expenses or at least put a cap to these expenses. And we're going to get into what those options look like here pretty soon. But that's Part A of Medicare. Now, Part B of Medicare, so this is the second part that the government provides. Part B of Medicare, so as you're planning retirement or you're planning on making the switch to Medicare, and you're trying to figure out how much is Medicare going to cost? What is all this going to cost me? This is the first dollar amount that you're going to write down. So if you're taking notes right now and you're trying to figure out what your monthly budget looks like in Medicare, this is premium number 1. The Part B premium is $148.50 per month. Right now it's $144. These are 2021 numbers. They just came out recently. So next year, Part B premium, $148.50 per month per person. In parentheses, you can see that it can be adjusted based on your income. I'm not going to dive too deep into this right now, but just know that that premium could be higher based on your income. So if you're a higher earner, there's like 5 different income brackets that you could potentially fall under, and you could pay more than the $148. Okay, so after this, if you're interested in knowing more about that, just give me a call or shoot me an email and let me know. But for today's purposes, we'll just use the $148.50 as the cost of Part B. So remember what we just covered on Part A. Part A is all of your inpatient hospital expenses. Part B is all of your outpatient related expenses. So there's a lot that rolls up under Part B. That includes your primary care doctor visits, specialist visits, any diagnostic tests that are run, ambulance falls under Part B, medical equipment. Those expenses are under Part B of Medicare. Now, just like Part A, Part B doesn't cover all of it. Okay, it covers a portion, and it leaves you responsible for a portion. So here's how Part B works. Under Part B, you have a very small deductible. It's $203 next year. So you cover, and that is a one-time deductible, okay? That's just a one-time, you cover the first $203 of your medical expenses under Part B, and then for the rest of the year, Medicare picks up 80% of your expenses, you cover 20. Now 80% is pretty good. That's covering a pretty large chunk of your expenses. The issue though, under Part B, if you had it by itself, you're paying 20% of all of your medical expenses up to an unlimited amount. There is no cap. Okay, so if you start thinking about maybe an ambulance ride, or chemotherapy, or outpatient surgery, or rehab, specialist visits, testing, you're paying 20% of all those bills, and there is no limit to what you are responsible for. So while Medicare A and B provides this base coverage, again, that's the purpose of having some type of insurance plan, is that it'll help pick up some of these costs or put a cap to them. So we're going to get into that here very soon. But that is the government portion of Medicare, Part A and Part B. All right, Medicare Roadmap. So anytime I have a one-on-one session with someone, and we're just trying to get a basic idea of, once you're on Medicare, what are your options? What are your choices at this point? And I'll pull up some options here down at the bottom, but just a couple quick notes on Part A and Part B, okay, before we pull up these options. So keep in mind a couple things. First thing is the cost that we just talked about. So under Part A, no monthly payment. Under Part B, $148.50 per month. Doesn't matter what insurance plans you pick, you're always going to pay the $148. That's a constant payment. Okay. If you are collecting Social Security by the time you get on Medicare, then that $148.50, it will just automatically come out of your Social Security check every month. If you're not collecting Social Security, that $148.50, the government, Medicare will send you a bill in the mail for that. And it's actually a quarterly bill. Okay, so the first bill you get is $148 times 3. Also, as you're planning this switch, this transition to Medicare, the timing of it is important to know. Okay, so you're allowed to apply for Medicare A and B. That's step number 1. Apply for A and B once you're within 90 days of when you need it to start. Okay, so I'm talking to a few folks right now that they need to go on, they plan on transitioning to Medicare February 1st. 90 days prior to February 1st is November 1st. So they just crossed into that 90-day window. So I'm advising them, go ahead and apply for Medicare right now. So you're within that window, fill out the application for A and B, and you got to get that application filled out first. You'll eventually get a letter in the mail that says, here's your Medicare number. And then once you get your Medicare number, you can take the next step, which is applying for one of these two options. You sign up for either a Medicare Advantage plan or a Medicare Supplement plan. Okay, I'm going to walk you through the pros and cons of each option. Okay, so Medicare Advantage, this is option number 1. What's really attractive about an Advantage plan are a couple things. The first thing is the monthly cost. So if you're anywhere near turning 65 right now, you are getting bombarded in the mail with all kinds of junk mail, all kinds of emails and phone calls, and most of that junk mail, when you open it up, it'll have a big $0 sign on it, and it says, sign up for, and you see these commercials on TV as well, $0 per month for this plan. This is what they're referring to. They're referring to a Medicare Advantage plan. So the low monthly payment, $0 per month, is what most of those cost. So you don't pay a premium, but what you do pay for are your medical expenses at the time that they occur. And you usually pay for them in the form of a copay or a percentage. So for example, if you go to the doctor, your primary care doctor visits are usually very low copays, usually $5 or $10. If you need to see a specialist, it's usually $40, $45, something like that. If you spend a day in the hospital, the copays are a lot higher. It's usually $300, $350 copay for each day that you're in there, up to a certain number of days. Emergency room copays, $90. Every medical expense has some type of dollar amount, copay, or a small percentage that you're paying. Okay, so what you're paying out of your pocket is counting towards what they call an out-of-pocket maximum. Okay, so just like the health plan that you have right now, either on your own or through an employer, there's a limit to your plan that says that if you end up spending this much money out of your pocket, and you hit this limit, then you're covered 100% after that. Same thing on these Advantage plans. The limits are usually around $4,000 to $5,000. Okay, so you have no monthly payment. You pay co-pays for all of your medical expenses, and then if you end up spending up to that maximum $4,000 to $5,000, then you're covered 100%. Okay, so that's how these plans are structured. The drug coverage of Medicare, so that's under Part D. D is in drugs. Under Part D of Medicare, that's included in these Advantage plans. Okay, so at no additional cost. So you're also going to have co-pays for prescriptions built into this plan. These plans also like to throw in little added benefits like dental and vision and hearing. So you'll have some type of coverage there as well. They kind of bundle it all together into one plan for no monthly cost. Networks. So the last thing to talk about here on Advantage are the networks of doctors and hospitals. So that's an important part of making this decision is the network of providers. So that's part of my job, is that if you're interested in an Advantage plan, I'll ask you, what doctors are important to you. Give me a list of any providers that you definitely want to keep in your network or hospitals. And obviously we want to make sure whatever Advantage plan you sign up for, your provider is in the network. Okay, so that's a very important piece of that. So that's kind of a crash course in how Advantage plans work. And now on the other side, this is option number 2. Option number 2 is Medicare Supplement. You'll sometimes hear the term Medigap. It's the same thing. Supplement, Medigap, same, referring to the same thing, okay? It is a complete opposite of what I just went over for an Advantage, okay? So under a supplement, the concept of this style of plan is that you have a higher monthly payment in exchange for a much lower out-of-pocket for medical expenses. So for example, there's a supplement plan called Plan G. I'm just going to provide this example. It's the most commonly purchased supplement plan today. Under Plan G, your only responsibility in medical expenses is that Part B deductible. Remember that deductible we went over on Part B, it's $203 deductible. You are responsible for that deductible, so you cover the first $203 of your medical expenses, but once you do that, for the rest of the year, the supplement plan picks up all those expenses that we just covered under Part A and Part B. It covers your Part A deductible, all your expenses under Part A, that supplement covers it all, 100%. Under Part B, you had the $203 deductible, and then after that, you have to pay 20% of your expenses. It covers that entire 20%. So your maximum out of pocket for the year is your deductible, $203. That's it. Now that comes with a monthly payment. All right, it's not zero like the Advantage. So, and that monthly payment is based off of age and gender and where you live. The average cost for someone turning 65, you're looking somewhere between right around $105 to $120 a month, somewhere in that range, depending on those factors. So much higher monthly payment, but a lot less out of your pocket in medical expenses. Also, networks. So when you're on a supplement plan, the name kind of says what it does. It supplements Medicare. So when you're on a supplement plan, Medicare is actually your primary insurance. Supplement is secondary. So when you have that kind of setup, what that means is that you can go to any doctor in any hospital in the entire United States. As long as they are accepting Medicare, then your supplement has to cover the expense. Plans on traveling a lot when you retire, or if you have a home in another state or a family that you visit a lot out of town, when it comes to traveling and if something happens to you, the supplement plan is going to cover you nationwide. It's the most flexible when it comes to network. Advantage plans, you have to be careful, okay? So if it's something really major and life-threatening, they will cover you nationwide. They don't penalize you for going out of network if it's a life-threatening emergency. But if it's not, then there's a potential that it might be covered. Okay, so you got to be kind of careful with networks on Advantage, not so much on supplement. Part D of Medicare, so again, that's the drug coverage of Medicare. It is not included in any supplement plan. So that's why there's a separate column here and a plus sign, because you're going to add a separate Part D drug plan. Okay, so that's two different plans that you're buying. You're buying the supplement for your medical, Part D for your prescriptions. Average cost of a drug plan is about $15, $20 a month. okay? So more expensive way to go in the supplement, but again, lower out-of-pocket, but Advantage is less expensive, has more different things built into it and bundled together. So that's what it all boils down to, these main two options. There's one rule that you need to, this is another one of those items that you got to remember as you're planning this. It's a very common misconception. I'm hearing it right now. So right now we're in the middle of this Medicare open enrollment period, and a lot of people believe you can just freely switch around to any plan that you want, and that is not the case, okay? So here's the rule that you need to know. When you first get signed up for Part B of Medicare, okay, the date you start on Part B, not Part A start date, Part B start date. When you first get enrolled into Part B, there is a 6-month window where you can sign up for any supplement plan that you want through any company that you want, and they cannot ask you any health questions. Okay, it's guaranteed. Doesn't matter, healthy, sick, pick any plan you want, it's yours. That guarantee window is only a 6-month window. So let's say, for example, you take an Advantage plan first, and then a year or two goes by, and you decide, I want to switch over to a supplement. I think I want to upgrade my coverage. You're allowed to, okay, during the open enrollment period. However, it's no longer guaranteed. You have to qualify based on your health. So if you go to switch from an Advantage to a supplement, whatever company you're trying to sign up through, they're going to have you fill out an application. You have to answer health history questions, such as have you had a heart attack or stroke or cancer, been in the hospital recently, need to have surgery. If you answer yes to any of those health questions, you're not allowed switching. Okay, you cannot switch. You have to stay on an Advantage plan. Okay, now if you're on a supplement and then you want to switch over to an Advantage, you're always able to make that switch, supplement to Advantage. It's just going back to a supplement, you have to be healthy enough to do it. Okay, so my job in all this is never to sway anybody one way or the other. Advantage or supplement doesn't matter to me, but just know the pros and cons of each plan and know what the rules are later when it comes to switching. Okay, that's an important part of trying to figure out which option do you take. All right. All right, that's a lot of info. I know I'm just pouring on a ton of info on you, and we got a few more slides to go, and then we're all done. This is just this is a really busy grid of the different supplement plan options that you have to that are available to you. There, I highlighted 2 of them here, Plan G and Plan N. Those are the most commonly purchased supplement plans today. We're not going to go through this grid, but just be aware there's quite a few options, but there's some holes here when you look at the benefits. We don't really sell those at all. Happy to go over all these with you at some point, but really G and N are the main 2 that you want to start with. Okay, drug coverage of Medicare. This is by far, in my opinion, the most complicated part of Medicare to explain and understand. So hang with me here. Once you get through this slide, then we're home free. Not too bad after this, okay? So hang in there. But what you're looking at on the screen, this is, I got a little typo right here, but I'll have to fix that. What you're looking at on the screen is how all drug plans in Medicare are structured. Okay, it doesn't matter if you're on an Advantage plan, doesn't matter if you're on a separate Part D drug plan, they're all structured the same way. All right, the term donut hole, I'm not sure if you ever heard the term donut hole before, but that refers to the prescription coverage of Medicare. So I'm going to help you understand what they mean when they say that. All right, so basically the drug coverage is broken up into 4 different stages. You have the deductible stage, the initial coverage period stage, coverage gap stage, also known as donut hole, and then the final stage they call catastrophic coverage. 4 stages of drug coverage. Stage number 1, deductible. Medicare says that your deductible on your prescriptions, you start out paying $445 deductible on your medications. Now, there's a lot of leeway here that the government gives these insurance companies. So some of them don't even have a deductible at all. Some do, but they only apply it to expensive, like brand name drugs. They don't apply it if you're taking generic drugs. Some deductibles are a lot lower than $445. Some are $100 or $200. So you might have a deductible, you might not. But once you're through this stage, or if you don't have a deductible, then you jump right into the second stage of the initial coverage period. So all that happens in this stage is that when you go to the pharmacy, you're paying a copay or a small percentage of your medications, okay? And then the insurance is paying the rest. So what happens in this stage is that at the end of every month, you get a letter in the mail from your insurance company that says, here's a summary of the prescriptions that you filled last month. Here the first one that you filled was $5. You paid $5, and then the insurance company paid $20. The other medication that you filled was $15 that you paid for, but the insurance company paid $30 of that. So what they're doing is they're adding up how much you're spending, and then adding up how much the insurance is spending, and they're coming up with a grand total of costs for the year. And they do that every month, and they keep track of that total. If the total cost of prescription costs, what you're spending and insurance is spending, if that ever hits $4,130, then you are entered into the next stage of coverage called the coverage gap, aka donut hole. Now you no longer have copays for your prescription. Now your medications are covered at a percentage, 25%. So the plan pays 75% of your medications at this point, you cover 25%. So you keep paying 25% of your medications, and then the remainder, 75%, 70% actually of what is left over, they are keeping track of that as well. And they're keeping track of what you're spending, 70% of what the insurance is spending, and if the grand total for the entire year hits $6,550, and again, that's not all out of your pocket. That's a combination of you, and most of it is actually out of the insurance. Okay, so I know that's kind of a big number, but that's not what's all coming out of your pocket. But if your total cost for the year hits $6,550, now you're out of the donut hole and you've hit the final stage here where you're not responsible for any more than 5% of your medication. Now your costs are going to go way down. I can't see any of you on the call, but I can guarantee half of you are, shaking your head like this, like who comes up with this stuff, right? So, but your experience in this is just all based on how many medications you take, how expensive they are. Everybody's experience is completely different, okay? So I have some clients that, they've never seen the donut hole. Like my grandma, for example, she's 88. She's never hit the donut hole in the 20 plus years she's been on Medicare. She's just been one of the fortunate few that, really hasn't had anything major. Then I have some folks that are on, a dozen medications and they're all expensive and they blow through this whole thing in, 5 months. So that's part of my job as well, is when, you're ready to make this transition, I'll get a list of your medication and I'll run it. We have a little software that shows me what plan best fits your particular needs, but it also shows me, are you going to hit the donut hole? What month? Most people don't hit their donut hole, just so you know. But if you do, what month is that going to happen? What are your costs going to look like at that point? And I show that to you, so you know exactly what to expect on the prescription side. All right, moving on. Just a couple more slides, and then we're finished, and we'll move on to Social Security. All right, there are two main penalties in Medicare that you need to be aware of. Okay, the Part B penalty and Part D penalty. The Part B penalty is not on this slide because it's what I already talked about at the beginning, and that was as long as you have coverage through your employer and that employer has 20 or more employees, then you're fine. There is no Part B penalty at all. Okay. Part D penalty goes one step further. Okay, and it says that even though you have coverage through your employer, that health plan that you're on through your employer, it has to meet Medicare standards. Okay, it has to be good enough according to Medicare when it comes to prescription coverage. And the term that they use is called creditable. Okay, so as long as your plan at work is deemed as creditable, then you're fine. You don't have to worry about the Part D penalty either. Okay, how do you know if it's creditable or not? Well, during your employer's open enrollment period, they are required to give you a notice to let you know that whether your plan is creditable or not. I know from experience that no one reads that notice. So But just know that they are providing you this notice and letting you know whether it's creditable or not. If it's non-creditable, then just be aware that, I think it's moving. Just be aware that there are some strategies to help avoid paying that penalty. I'm not going to go through all those strategies today, but just be aware that if it's a non-creditable plan, reach out to me and let's talk through your situation, and we'll go over over how to avoid paying that penalty. If you do end up getting hit with that penalty, it's not much. It's a small penalty, but it is something that you have to pay every month for the rest of your life. So find out if your plan is credible or non-creditable if you don't know already, and that's an important part. All right, 2 more slides. Okay, this has to do with HSAs. Okay, so just keep in mind that if you enroll in Medicare, remember, if you enroll in any part of Medicare, you can't put money in your HSA anymore, right? Now keep in mind that Mike's going to talk about Social Security here soon, and there's all these different ages that you can collect Social Security. Just keep in mind, I'm not here to tell you, when to take it, but I am here to tell you that when you sign up for Social Security, let's say you do it at, your full retirement age at 66 or 66 in a couple months, just be aware that you will be automatically enrolled in Medicare, which means you can't put any more money into your HSA. All right. So if that's very important to you, then you want to factor that in on, when to take Social Security. Now, this rule that I just went over a couple times about, if you're signed up for Medicare, you can't put money into your HSA. That only applies to you as the employee. If you are enrolled in Medicare, that's what they care about. They do not care if your spouse, if you have a spouse on your health plan at work, and if they're enrolled in the Medicare, no impact at all. You're fine. Okay? So if your spouse turns 66, they collect Social Security, they get enrolled in the Medicare, no impact. You can still put money into your HSA as long as you're not enrolled as the employee. You can still contribute up to the family maximum. You can still put money into the, or you can still use that money for your spouse's expenses. Okay? So no impact at all with a spouse on Medicare, just you as the employee. All right. Green box in here, that's the most you can contribute as a single person on the single medical account. On the family, 2 or more, $7,200 is the most. If you're over age 55, you can add another $1,000 to each column. Okay, $4,600 or $8,200. That's the maximum you can put in. Okay, so last slide here. When you get on Medicare, and if you have any money sitting in this HSA, you can't put any more into it. But now you can use the money that's left over in that HSA to help pay for your Medicare expenses, almost all expenses and almost all premiums. Okay, that Part B premium of $148.50, you can use your HSA money for that. The drug plan premium, use your HSA money for that. Any copays for prescriptions, Advantage plans, most of them are zero, but there are some that charge a premium. You can use HSA money for that. The only thing that you can't use that money for, which I don't know why, but you can, are your Medicare supplement premiums, your Medigap premium. Can't use it for that. But deductibles, copays, premiums for any other parts of Medicare, you can use your HSA money for that. So very helpful account. The money goes in tax-free, comes out tax-free. So if you're able to put money in there and stash that away for when you go on Medicare, it can be very beneficial. Okay, last rule, last head shaker rule that you need to be aware of in Medicare. Just know that this does not apply to you when you're turning 65. This applies to you if you sign up for Medicare and you delay it until a later age. So if you don't sign up at 65 because you have coverage through your employer and you wait until a later date, let's say 68, you sign up for Medicare for the first time, just be aware that when you sign up for Medicare, Part A of Medicare, there's no charge to it, but what they do is they retroactively start it back 6 months. Why do they do that? Well, the best I've read on this is that it was originally intended as a benefit. They will retroactively cover any hospital expenses you may have had going back 6 months. But the consequence to that is that now that you are signed up for Part A of Medicare, remember, you can't put any more money in your account, HSA account. But because they take it back 6 months, that means you have to stop putting contributions in your HSA 6 months before you plan on signing up for Medicare. Right? Who comes up with the stuff? But just be aware of that rule. And as you're planning retirement, that's what we're here for. We're your resource to help you put a timeline together of, okay, here's your retirement date. Make sure as of this date you stop your HSA contributions. As of this date, apply for Medicare. We walk you through the entire process so you don't miss anything. So that's what we're here for. We're your resource to walk you through this. All right. All right, I think I'm coming up right on time, and I just want to show you this last screen. And again, we're going to send copies of this presentation out later, but just be aware, again, we're here to help you if you need it. And I will stop sharing and then hand this over to Mike to take over for Social Security. Go for it, Mike.
Great. Thank you very much, Nate. Awesome job as always. Bear with me for a minute as we get set up here. All right. So as Nate mentioned earlier in his presentation, don't feel like you have to walk away from any of this feeling like an expert. Just know that you have resources available to you should you have any questions. So we don't charge for Medicare or Social Security planning. And so with that being said, my name is Michael Hermes. I'm a wealth advisor at HORAN. I'm a certified financial planner, chartered financial analyst, and national Social Security advisor. And so really when it comes to retirement planning, that is my specialty. That's what I do all day, every day. And so we're going to spend the next 45 minutes or so talking about Social Security and different strategies you can utilize to maximize your benefits. Before we dive into this, one of the things that I like to tell everyone is if you're working with a financial advisor or you're thinking about working with a financial advisor, always double check and make sure that you are working with a fiduciary. And so what a fiduciary is they are held to the highest standard in the financial services industry. So everything that they recommend to you has to be in your best interest. They can't sit there and sell you products to make a big commission. So at HORAN, all of the advisors here are fiduciaries. One way of knowing if you're working with a fiduciary or not is if they have the letters CFP after their name. So if you get their business card and they have the letters CFP, which stands for Certified Financial Planner, they must act as a fiduciary at all times when making recommendations to you. But with that being said, we're going to jump right into it. And just as a reminder, we will be sending out copies of the presentation after, along with a recording of the presentation. And today we're going to be focused on a lot of different topics when it comes to Social Security. The first is, will Social Security be there for you? You hear a lot about how the system's going broke, and so we'll debunk that myth just a little bit. How much you can expect to receive from Social Security? When should you apply for your benefits and different strategies you can utilize to maximize those benefits? If you have a state or government pension, also known as a non-covered pension, instead of Social Security, how that can negatively impact your benefits, how your Social Security is taxed and how it fits into your retirement picture. Something new, which was recently introduced, I believe back in 2018, is how to designate a representative payee on your benefit. So if you were to become mentally incapacitated, someone that can make decisions for you on your behalf with your Social Security benefits. And once again, lastly, how it all fits into your retirement picture. So every single year, the Social Security Administration releases their annual results. 2020 just came out, so I didn't have time to update that yet, but this is as of the end of 2019. And so every single year, about $1.06 trillion comes into the system via taxes on your paycheck. And then every single year, about another $1.006 trillion leaves the system in the form of benefit payments. So at the end of 2019, there was actually a surplus of about $2.5 billion. So more money coming into the system than flowing out, which is a good sign. And that surplus goes into the Social Security Trust Fund, which currently stands at about $2.9 trillion. And that trust fund sits there in reserve, earning interest, ready to be paid out to beneficiaries in case there's no more surplus. So it's actually projected that this year, 2020, and especially with the pandemic that happened, that there's no more surplus. So going forward, every single year, Social Security is going to have to start dipping into that trust fund to guarantee everyone will receive 100% of their benefit payment. And so without any sort of reform, it's expected that by the year 2035, that trust fund is depleted to zero, so they can only pay out as much as they take in every year. So in the year 2035, everyone will get roughly 79% of their benefit amount. So it's not that your benefit will go away completely. You still will receive a benefit, but it will be roughly 79% of what you can expect to receive in the year 2035 if things continue to play out the way that they are. And so that's without any sort of reform. There's a lot of ways to fix that deficit in the Social Security system. Currently in Congress, there's a bill called the Social Security 2100 Act. And if this gets passed, everyone will get 100% of their benefit payment through the year 2100. And really the key of the bill is to fix the system in two ways. The first is to increase the overall tax rate. So currently both you and your employer pay 6.2% Social Security tax on your wage base. And so what they're going to do is increase that by another percent to 7.2% gradually over the next 25 years. Okay, so increase the overall tax rate is the first way. And then the second way is to increase the overall amount that is subject to income tax or Social Security tax rather. So currently the way it works is the first $137,700 of your Social Security benefit or of your income is subject to Social Security tax. If you make over $137,700, you do not pay Social Security tax anymore. So what they're going to do is incorporate an income donut hole, if you will, where if you make over $400,000 per year, the tax will kick back in. So that's the second way that they're going to fix that shortfall in the system is to increase the overall amount that's subject to tax. There are a lot of other ways that this could get fixed, but we'll kind of see what happens over the next few years. I would imagine something over the next 4 years would get passed when it comes to Social Security benefits. All right, now how much can you expect to receive from Social Security? So hopefully everyone on this call today has taken a look at their statement before. If you haven't, this is what the front page of your statement will look like. And in the top right-hand corner, there is a big bold number. And that number is the amount you are eligible to receive at your full retirement age, which we'll get into in a minute. But how are they coming up with your Social Security benefit amount? What they are doing is they are using the highest 35 years of your earnings history, plugging it into a formula that's too complicated to go over today, and outspits your benefit amount. The national average Social Security benefits around $1,500 per month or so. But the key to remember is that they are using the highest 35 years of your earnings history. So when you get your Social Security statement and you turn it to page 3, it will show you every single year you contributed to both Social Security and Medicare. So go through that earnings history and make sure it looks accurate. Make sure you don't have any zeros in there for years you in fact did contribute to Social Security. We've seen it happen, and it typically happens to individuals who are ever self-employed. So go through, double check, make sure your earnings history looks accurate, make sure you don't have any zeros in there for years you in fact did contribute. Because if you do, that will negatively impact your benefit amount. If you're going through your statement and you're counting up how many years you contributed, and you contributed 34 years, and you're planning on working one more year to get that 35th year, I promise you it is not worth it. So you will end up paying more in Social Security tax versus what you'll get back out from a benefit standpoint. And so the break even on that is roughly age 160. So I don't know about you, but I don't think I'm going to live to 160. So the point being, if you have 34 years, don't work one more year just to increase your Social Security benefits. But once again, go through your earnings statement, double check it, make sure it looks accurate. Here's an idea of what that will look like. I know it's a little small to see. And if you've never seen your Social Security statement before, or if you have received it previously and through the mail, I would encourage everyone on this call today afterwards to log into the Social Security website, so socialsecurity.gov or ssa.gov, and create an online login, and then you can pull your statement at any time and get an idea of what your benefit is. And so one thing to note is when you do sign up for your Social Security statement online, they will stop mailing you paper copies. All right, so when should you apply for your Social Security benefits? So as I previously stated, when you receive your statement in the top right-hand corner, there's a big bold number, and that number is the amount of Social Security retirement benefits you are eligible to collect at your full retirement age. And your full retirement age is, once again, when you can collect 100% of your Social Security benefit. And everyone's full retirement age is different. So your full retirement age is determined based off of the year you were born. So if you were born between 1943 and 1954, your full retirement age is 66. And they kind of stagger it every 2 months going forward. And if you were born 1960 and later, your full retirement age is 67. So interesting fact about Social Security, when it was first started, the full retirement age was 65, but most people only live to be 65 years old. Nowadays, the latest full retirement age is 67, and most people live to be in their early 80s. So benefits are getting paid out a lot longer than what they used to be. And so I wouldn't be surprised if in some sort of bill about fixing that shortfall, they start to extend that full retirement age later and later. But for purposes of the presentation today, most people getting ready to apply are their full retirement age is 66. So I'm going to use full retirement age and age 66 interchangeably. Now, you don't actually have to wait until your full retirement age to begin collecting your benefit amount. The earliest you can take your Social Security is actually age 62. But each year you take your benefit early, it's going to be discounted roughly 7% per year. So on the left-hand side there, if you look at that chart in the middle column, if your full retirement age is 66 and you take your benefit at age 62, you will receive 75% of your benefit amount. And once you've collected Social Security, you've collected it. That's the amount you are going to receive the rest of your life. On the opposite end, each year you delay taking your benefit past your full retirement age, not continuing to work, just delaying taking your benefit will grow a guaranteed 8% per year. So if you wait until age 70 on the right chart there in that middle column, if you wait until age 70 to begin collecting and your full retirement age is 66, you will receive 132% of your benefit amount for the rest of your life. Now, I was actually working with someone one time. They were age 72. They called me up and said, Mike, when should I start collecting my Social Security benefit? And I told them, well, you should have started collecting it 2 years ago because there's no delayed retirement credits after age 70, meaning it won't continue to increase 8% per year. And so he actually called up Social Security, and the most that they would lump sum him back was 6 months worth of missed payments. So he actually ended up missing out on 1.5 years worth of Social Security because he waited too long. So never wait past age 70 to begin collecting your benefit. When you get your statement and you open it up to page 2, it will look something like this. And so at the top there, in the top right-hand corner, it will tell you what your benefit is at your full retirement age, your age 70, and at age 62. But if you read the fine print, okay, it assumes the benefit amounts that they're estimating you, they assume that you continue to work at whatever earnings you're currently making until that age. So for example, the age 70 amount, they're assuming that you continue to work through age 70 in order to collect that benefit. So if you're not planning on working until 70, just know that your actual benefit amount might be a little bit lower than what they're quoting you. So when should you start taking your benefit, right? That's kind of the million-dollar question. Age 62, your full retirement age, or sometime in between? Well, you ask 100 different financial advisors, you're going to get 100 different answers. And so just because your friends or family did one thing does not mean that that is best for your personal situation. Everyone's situation is different. So some things to consider is your health status. If you're single and you're in bad health and you don't think you're going to live very long, you'll probably want to go ahead and start up your Social Security early and get as much out of the system as you can while you're still living. Next is life expectancy. So on the opposite end, if you do think you're going to live a long time and your family does have good longevity, it might make sense for you to wait until age 70 to begin collecting. So for example, if you wait until age 70 to collect versus taking it at 66, you're missing 4 years worth of payments by waiting, right? And so the break even on that is roughly age 82. So if you think you're going to live longer than 82, it would have been beneficial for you to begin to delay collecting until age 70. Number 3 there is need for income. So if you're retiring and you don't have any, excuse me. Sorry, I got a bug in my throat there. Number 3 is need for income. So if you're planning on retiring and you don't have any other sources of income, you'll probably want to go ahead and start up your Social Security benefit, right? You need some money to live off of in retirement. Number 4 there is survivor needs. So if you have dependent children, which under the age of 18, which we'll talk about at a later time period, you might want to start up your Social Security benefit so that they can collect a benefit off of your record. Or you might want to wait until age 70 to begin collecting so your spouse has a higher survivor benefit should you pass away. Lastly, there is whether or not you plan to work. And this is a big one, and we see a lot of people mess this up all the time. With Social Security, there is something called the annual earnings test. What this says is if you are working and you begin collecting your Social Security benefit before your full retirement age, so 62, 63, 64, 65, and once again, you're still working, you cannot make more than $18,240 per year at your job, or Social Security is going to withhold a portion of your benefit amount, okay? So typically what we see happen is you're 63, you retire, and you start up your Social Security benefit, and so because you started it early, it's discounted and you're not even getting the full amount, and then a year goes by and now you're bored from retirement, so you pick up some part-time work and end up making more than $18,240 per year. Because you're making more than that threshold, that earnings limit, you get a nasty letter from Social Security saying that they overpaid you benefits and that they will have to hold a portion of your benefits going forward. And so, once again, the way this works is if you collect Social Security before your full retirement age and you are still working, you cannot make more than $18,240 per year, or Social Security is going to withhold a portion of your benefit amount. January 1 of the year you hit your full retirement age, so January 1 of the year you turn, we'll say 66, that earnings threshold goes up. You can now make up to $48,600 per year before you are subject to that earnings test. And then the month you hit your full retirement age, so for me, November 1st of the month that I turned 67, there's no more earnings test. You can make as much money as you want in retirement and collect your full Social Security benefit amount, okay? So once again, the month you hit your full retirement age, this earnings test goes away. You can make $1 million per year at your job and collect your full Social Security. So if you take nothing else away from the slide, just know that full retirement age, no more earnings test. It's important to note that $18,240 and $48,600 thresholds only apply to earned income from wages and self-employment. If you are taking money out of investment accounts like IRAs or 401ks, or you have an old pension from a previous employer, or you have rental property income, that does not count towards that number. So let's take a look at an example here. So here we have Janet, who was born November 22nd of 1957, which means her full retirement age is 66 and 6 months, or May 1st of 2024. So from age 62, to 12/31 of 2023, she cannot earn more than $1,520 per month, or $18,240 per year. And then from January 1, 2024 to April 30th of 2024, she's now in that next tier, so she cannot earn more than $4,050 per month. And then come May, her full retirement age, there's no more earnings test. All right, so now we're going to get into some of the different strategies that you can utilize to maximize your benefits. And so the first one we're going to talk about is the spousal benefit. Just remember that when you go to Social Security and you apply for your benefit, they are strictly order takers, okay? They are not financial advisors. They are not going to make sure that you are utilizing the strategy that is best for your personal situation and give you a recommendation as to when to take your Social Security benefit. We like to say they're like a drive-through. You go in, you tell them what you want, and hopefully they'll give you what you asked for, okay? So the first strategy we're going to talk about is a spousal benefit. So here we have Jane and Mike. And so if you are married, you can collect the greater of your personal retirement benefit or 50% of your spouse's benefit. Okay, so once again, you can get 100% of your retirement benefit or 50% of your spouse's benefit. So here we have Jane and Mike. Jane's PIA is $2,000 per month. PIA stands for primary insurance amount. It is Social Security's fancy way of saying the amount you are eligible to collect at your full retirement age. So Jane's eligible for a $2,000 per month retirement benefit at her full retirement age, and Mike is eligible for $800 per month off of his record. Instead of Mike applying for his retirement benefit, he's going to collect his spousal benefit and receive 50% of Jane's $2,000 and get $1,000 per month instead of $800. Okay, pretty straightforward. So a couple things about this. So one is this does not negatively impact Jane's benefit at all. She will still receive the full $2,000. Second is Mike's benefit could be zero. He could have been a stay-at-home parent his entire career. He can still collect a spousal benefit off of Jane's record and get $1,000 per month. Something with the way Social Security works now is Jane must be collecting her retirement benefit in order for Mike to take the spousal benefit. So there used to be a strategy called file and suspend where that wasn't the case. That has since gone away from Social Security. And so the way it works now, it's called deemed filing rules. Jane must be collecting her retirement benefit in order for Mike to take the spousal benefit. With that spousal benefit, age 62 is the earliest you can begin collecting it, just like regular retirement benefits. But each year you take it early, it's going to be discounted roughly 7% per year. So if you collect a spousal benefit at age 62, instead of waiting till your full retirement age, instead of getting the full 50%, you'll get roughly 75% of the 50%. It's also important to note that there are no delayed retirement credits on a spousal benefit, meaning that don't wait past your full retirement age to begin collecting it because it will not continue to increase 8% per year past your full retirement age. With all these strategies, it's also important to note that that annual earnings test still applies. So if you're planning on taking a spousal benefit and you do it before your full retirement age, once again, you cannot make more than that $18,000 threshold at your job or they will withhold a portion of your spousal benefit. The next benefit is for divorced spouses. So if you were married at least 10 consecutive years, you can get the greater of your benefit or 50% of your ex-spouse's benefit. Unlike last time where I said Jane had to be collecting in order for Mike to take the spousal benefit, as long as your ex-spouse is at least age 62, and as long as you have been divorced for at least 2 years, you do not have to wait for your ex-spouse to begin collecting their retirement benefit for you to take the spousal benefit, okay? You can just go ahead and start up your divorced spouse benefit. But all the other rules still apply. 62 is the earliest you can begin collecting. There's no delayed retirement credits on an ex-spousal benefit, and that annual earnings test still applies. A couple tacky things about divorced spouse benefits. I could have 3 ex-spouses. I could have been married 3 times, all of which lasted 10 years or more. I could technically have 3 ex-spouses collecting off my record. I don't know what's happening, and it doesn't negatively impact my benefit, but I could have 3 ex-spouses collecting off my record, or vice versa. If I wanted to collect the divorced spouse benefit off one of their records, I don't get all 3. I get 50% of the highest for whosever benefit I'm eligible for. All right, the third strategy here is with survivor benefits. So if you were married for at least 9 months and your spouse passes away, you can collect the greater of your retirement benefit or 100% of your deceased spouse's benefit. So you don't get both. You just get the greater of your retirement benefit or 100% of your deceased spouse's benefit amounts, okay? So here we have Chris and Julie. Chris's benefit's $2,000 a month and Julie's benefit is $1,200 a month. Chris passes. Julie's going to apply for her survivor benefit. She's going to notify Social Security. That's important. They're not going to come to you and let you know you're eligible for this benefit. You go to them, and Julie's $1,200 a month retirement benefit is replaced by her 100% survivor benefit. So she will receive Chris's full $2,000. One strategy that we'll often see couples use is whoever has the higher Social Security benefit will let theirs grow until age 70. So that way, if they were to pass away, a surviving spouse can collect 100% of that increased benefit amount. So it acts as some additional insurance, essentially, should that spouse pass away. A couple things to note about survivor benefits. Once again, you must have been married for at least 9 months in order to qualify. Unlike Social Security retirement benefits, where 62 is the earliest you can begin collecting, with a survivor benefit, you can actually collect this as early as age 60. But once again, each year you take it early, it's going to be discounted roughly 7% per year. And then it's also important to note at the bottom there, if you were married for at least 10 years and you get divorced and your ex-spouse passes away, you can collect the greater of your retirement benefit or 100% of your deceased ex-spouse's benefit amount. If you remarry after age 60, you can still collect that benefit. If you remarry before age 60, you lose the ability to collect that survivor benefit off your ex-spouse. So I actually ran into someone one time who was 59 and a half, who qualified for a survivor benefit off of their ex's record at age 60, but at 59 and a half, they ended up getting remarried. So they lost about $2,500 per month of income that they couldn't have. And so our recommendation to them was to temporarily get divorced, okay? Start up that ex-spousal benefit at age 60, and then ex-spousal survivor benefit at age 60, and then after age 60, get remarried to her current spouse. So in the eyes of Social Security, it's one of those weird loopholes where it technically would have worked, but for all of you wondering, she didn't end up going through with it. All right, this brings us to dependent benefits. So we have a client at HORAN who is 66 and is collecting his Social Security benefit. And he is about to welcome his 7th child into this world. And so your children are eligible, or your dependents, as long as they are under age 18, are eligible to collect 50% of your benefit amount while you're living, or 75% of your benefit amount if you were to pass away. And once again, they're eligible to collect this through age 18 as long as they're enrolled in high school. And so same example as last time, except now we have a child, Johnny. Chris and Julie, they adopted a child, Johnny, which is typically what we see happen. And Johnny, we'll say, is 15. So Chris is eligible for $2,000 a month. Julie's eligible for $1,200. Chris passes away. Julie's going to apply for her survivor benefit and get Chris's 100%, or $2,000 per month. And now that Chris has passed away, Johnny can also collect 75% of Chris's benefit amount, or receive $1,500 per month through the age of 18, as long as he's enrolled in high school. All right, this brings us to the last complicated strategy left in Social Security, and this strategy is actually getting phased out of the system. So it's called a restricted application, and you can only do this if you or your spouse were born on or before January 1st of 1954. So once again, you can only do this if you were born on or before January 1st of 1954. It's called a restricted application, and I've seen this strategy make the difference of roughly $100,000 over the course of someone's life. So if you are eligible to do this, I would strongly encourage you to do this. Essentially, what a restricted application talks about is instead of touching your personal retirement benefit, you want to restrict your Social Security application to just your spousal benefit. Once again, you don't want to touch your retirement benefit. And so you're able to separate your spousal benefit from your retirement benefit so that they work independently. Whereas now, going forward, unfortunately, you can't do that anymore if you were born after January 2nd of 1954, okay? So here we have Mike and Jane. Mike's eligible for $2,000 a month, and Jane's eligible for $800 a month. Instead of Mike collecting his retirement benefit and Jane collecting that spousal benefit and getting half of Mike's PIA, Jane is just going to go ahead and start up her retirement benefit of $800 a month. Mike was born before January 2nd of 1954, and so he's eligible for a restricted application. So he is going to restrict his Social Security application to just his spousal benefit. He's telling Social Security he doesn't want to touch his $2,000 a month. He just wants his spousal benefit of $400 per month. So at his full retirement age until age 70, he's going to collect $400 per month off Jane's record. In the meantime, his personal retirement benefit of $2,000 is going to continue to grow 8% per year until age 70. So that at age 70, he's going to flip from his spousal benefit to his retirement benefit and collect $26.40 per month. Now that he's collecting his retirement benefit, Jane can flip-flop from her retirement benefit to her spousal benefit and collect 50% of Mike's PIA and get $1,000 per month, okay? So it's a little complicated. There's a lot of flip-flopping of records going on here. Essentially, all you need to know, born on or before January 2nd of 1954, on or before January 1st of 1954, my apologies, you qualify for something called a restricted application. Let me know and I can walk you through the details of exactly what that will look like for your personal situation. All right, this brings me to windfall elimination provision and government pension offset. We got about 15 more minutes or so to get through today, and then we're all done, and we'll stick around after for questions. But windfall elimination provision and government pension offset applies to individuals who have a non-covered pension. So not Social Security, a non-covered pension. The most two common ones in Ohio are the Ohio Public Employee Retirement System, OPERS, and the State Teacher Retirement System, STRS. If you have a pension through a private employer, such as GE, for example, this does not apply to you. Once again, it's only non-covered pensions. So with windfall elimination provision and government pension offset, what these talk about is that because you have this non-covered pension, you might not receive any Social Security that you're eligible to collect. So windfall elimination provision applies to individuals who have both Social Security, say they worked 10 years in the private sector, then switched to the public sector, and now have a non-covered pension that they contributed to for 30 years, okay? That's who this applies to, are individuals who have both Social Security and a non-covered pension. Because you have this non-covered pension, Social Security is going to say, hold up, you didn't contribute to Social Security your entire career, and so your Social Security benefit is subject to windfall, meaning you might not receive your full benefit amount. And the way you determine what type of impact a windfall will have on your record is based on the number of years you contributed to Social Security. So what you have to do, and this isn't reflected on your statement anywhere, so you have to manually calculate what this is, okay? Or you'll be unpleasantly surprised when you apply for your benefit amount. So what you have to do is you have to turn your Social Security statement to page 3 and count up how many years you contributed to Social Security. If you contributed for more than 30 years, there is no windfall, meaning you will get your full Social Security benefit and your full non-covered pension. If you contributed to Social Security for less than 30 years, use this table here and deduct a corresponding amount from your Social Security benefit, and that's how much you will receive from Social Security. So for example, if you have less than 20 years contributing, the most that Social Security can withhold from your benefit amount is $480 per month. They will never withhold your full Social Security benefit. You will always get something, okay? But just know this is the table that you can use to estimate what that benefit is. There are also online calculators that you can use as well to get a more accurate depiction of what sort of windfall you could expect on your Social Security benefit. But more than 30 years, no windfall. You'll get your full Social Security and full pension. Less than 30 years, deduct a corresponding amount from this table, and that should be a good estimate of what you can expect from Social Security. All right, the next one is government pension offset. And so government pension offset applies to individuals who don't have Social Security. They have a non-covered pension, but want to try to apply for Social Security benefits off someone else's record, meaning they're going to try and collect a spousal benefit or a survivor benefit, once again, off someone else's record, not their own. Because they don't contribute to Social Security and they have this non-covered pension, that's going to fall under government pension offset rules. With government pension offset, this might reduce any Social Security benefits you're eligible for to zero. So what Social Security is going to do is they're going to take 2/3 of your non-covered pension, subtract that from whatever you would have been eligible to collect from Social Security, and if that ends up being zero, then so be it. Unfortunately, that's zero. You won't get anything from Social Security. So let's take a look at an example. I think it'll make a little bit more sense. So Jane has a non-covered pension. We'll say Ohio Public Employee Retirement System pension of $3,000 per month. John has Social Security of $2,000 per month. John passes, and Jane's going to try and apply for her survivor benefit and collect 100% of John's Social Security. Because she has this non-covered pension, she falls under government pension offset rules. And so Social Security is going to take 2/3 of her pension, so 2/3 of $3,000 is $2,000, and subtract it from her survivor benefit of $2,000. So 2,000 minus 2,000, unfortunately, is zero. So Jane will not qualify for a survivor benefit. So that strategy I previously talked about, where one spouse might wait until age 70 to begin collecting to provide for a higher survivor benefit, might not make sense if the surviving spouse has a non-covered pension. These are two of the most complicated subjects within Social Security. So if you have questions about how your benefits might be impacted, just let us know. Happy to give you a more detailed idea of what that looks like for your situation. When you begin collecting Social Security, so you know exactly how you want to begin collecting it, okay, it's important to note that, once again, your Social Security is subject to income tax, okay? You've paid Social Security tax your whole life. Now you go to collect it, and only to find out that it is subject to federal income tax. There is no state or local tax in Ohio, Kentucky, or Indiana, okay? And the amount of your Social Security that is subject to tax is determined based off of your provisional income, which is all your income excluding Social Security, plus 1/2 your Social Security benefit, plus tax-exempt interest. So I don't know how the IRS comes up with this stuff, but that's what your provisional income is. So essentially, just know that if you are married filing jointly and your income is over $44,000, up to 85% of your Social Security benefit is subject to income tax. For most retirees, that's 10 to 12% or so. So once again, essentially what that means is 15% of your Social Security is tax-free. The other 85% you'll pay tax on. For most retirees, that's 10 to 12%. But the reason I bring this up is because when you apply for benefits, Social Security does not ask if you would like to withhold anything for tax. So make sure you say, yes, I would like to withhold something for federal income tax, because if you don't, more than likely come next April, you'll be surprised with a tax bill. And so you can choose between 7, 10, 12, or 22% federal income tax withholding, and you can change that at any time. All right, so now that you know how much you want to withhold for tax, you're actually finally ready to apply for your benefit. You have 3 different ways that you can begin collecting, okay? 3 months before you want to begin collecting is the earliest you can start the application process. So if you want to start at your full retirement age, which we'll say is April, you can start the application in January, okay? So you have 3 options. You can either visit your local Social Security office. You can call and schedule a phone appointment. There's the 1-800 number there. I encourage you to call at 7 a.m. to avoid any lines or any wait. Or lastly, you can actually file for your benefits online. It takes about 30 minutes or so. It's pretty straightforward. And then you'll get a call from someone from Social Security or a letter in the mail confirming your benefit amount. It's important to note that if you're filing online, you cannot file for a survivor benefit this way. You do have to visit your local Social Security office to file for that survivor benefit. It's also important to note that when planning for retirement, your checks are paid a month in arrears, meaning if you apply for your benefit to begin in April, you won't receive your first check until May. So make sure you have at least a month's worth of cash to get by on until you receive that first Social Security check. And the day that your check comes is determined based off of the day of the month you were born. So if you were born the 1st through the 10th, you will receive your check the 2nd Wednesday of the following month. If you were born the 11th through the 20th, you'll receive your check the 3rd Wednesday of the following month. And the 21st through the 31st, you'll receive your check the 4th Wednesday of the following month. All right, once again, something new in Social Security is how to designate a representative payee. It's important to note that if you have your estate planning all wrapped up and you worked with an estate planning attorney to draft a financial power of attorney, it's important to note that Social Security does not recognize these legal documents for Social Security. And so what you have to do is when you log on to the website and you scroll down on your account, there is a place where you can name up to 3 individuals who can make decisions for you about your Social Security should you ever become mentally incompetent to do so yourself. So everyone on this call, I would encourage you after today to go name up to 3 individuals who can make decisions for you because you don't want to get stuck where no one can make any decisions on your Social Security, okay? It's pretty straightforward. They only ask for, I believe, name, an address, and a phone number or email address. All right, last slide here. I work with a lot of retirees. That's my specialty. And so I think the biggest question I get from individuals is, how much money can I live off of in retirement without running out of money, right? That's the big question. Let's make sure you don't run out of money in retirement. And so here's the quick way of figuring that out. So what you'll want to do is you'll want to add up all your investment accounts, so into one big pot. So 401ks, IRAs, 403bs, etc. Add them all up into one big pot. A conservative retiree portfolio should make on average 4 to 5% per year. So the whole idea is you make 4 to 5% per year and you take 4 to 5% per year. And so your accounts kind of stay the same throughout retirement. So if you have, we'll say $100,000 saved up, that's about $5,000 per year, 5%, $5,000 per year that you can take from your investments. You're going to divide that number by 12 to get a monthly amount. So we'll call it $440 per month or so. So you have $440 per month that you can take from your investments. You'll have your monthly Social Security income, any monthly pension benefits that you might be eligible for, and if you bought an annuity somewhere from an insurance company, you'll also have your monthly annuity income. And so that's how much income you have coming into your household every single month. So when you're budgeting for retirement, make sure that you're not spending more than what's coming in, right? And so that's the quick way of figuring out how much you have coming in. We help individuals figure this out all the time. Once again, we don't charge for any of those services. There's Nate's beautiful contact information. So once again, feel free to call Nate with any questions on Medicare. My contact information's in here as well. Don't hesitate to reach out. But with that being said, we appreciate everyone's time today. Thank you for sticking with us. Hopefully you learned a couple things that you didn't know previously. And Nate and I will stick around afterwards to answer any questions that you might have. But once again, we appreciate everyone's time today. Thank you very much.